Good afternoon, everyone. Thank you for joining us today. This webinar is supported by Satellite Healthcare, and we thank them for their support. My name is Melanie Paris, and I'm the Senior Director of Health Initiatives and Education here at the American Kidney Fund. Before I introduce our guest today, I'd like to direct your attention to the control panel you should see on your screens. All participants are on mute, so we won't hear you, but we welcome your questions. If you have a question, please type it into the section of your control panel titled Questions. We'll see your questions and we'll do our best to answer them either by replying to you in the questions box or out loud during the last several minutes of the presentation. This webinar is being recorded and will be made available for viewing on our website, kidneyfund.org/webinars, within the next 1 to 2 weeks. For those of you in attendance who are health professionals, we are glad that you've joined us today and hope you'll recommend this webinar to the patients you work with. However, as a friendly reminder, this webinar is not accredited for continuing education. If you believe that your accrediting body may offer you credits for attending this webinar, we'll be happy to send you a certificate of attendance after today's session. Simply email us at education@kidneyfund.org. So without further ado, let me introduce today's speakers, Nadia Makrushin and Nazar Makrushin. Nadia
Hello.
and Nazar. Hello. Nadia and Nazar live in Elk Grove, California. Nadia runs an in-home child care business, and her husband, Max, serves in the U.S. Air Force. Nadia and Max have 2 children, Nazar, who is 15, and Maya, who is 8 years old. Nazar was born with spina bifida and has had many surgeries and health obstacles to overcome. In the past few years, however, or unfortunately, Nazar's kidneys have declined in function, and he's needed to start dialysis. Nazar started with in-center dialysis, but running back and forth from the dialysis clinic was extremely taxing when the nearest facility was 30 minutes away from their home. Nazar recently switched to home dialysis, which has had a huge positive impact on him and his family and their ability to function. Nadia believes that in-home dialysis has saved their lives and has helped Nazar better cope with his health issues and has allowed him to regain a sense of normalcy. Nadia and Nazar, thank you both for joining us today.
You're welcome.
So I'd like to start by asking you to each introduce yourselves. So Nazar, please tell us a little bit about yourself. Provide us some background on who you are, how old you are, your hobbies, and briefly describe your journey with kidney disease.
All right. Hi, my name is Nazar Makrushin. I'm 15 years old. I like to go outside, play little games, play with friends when they're over. It's been a journey with my kidney problems. I've been doing in-center for half a year, and once I knew about in-home dialysis, I went all for it. And once we established that, it's been a lot easier.
Thank you, Nazar. And Nadia, tell us a little bit about yourself, your family, about your occupation, and describe your journey as well, but from the caregiver and mother perspective.
Hi, I'm Nadia. I am a mother of 2 children, Nazar and Maya, who's 8. I do in-home childcare. I've done it for 15 years. And as a caregiver, I guess main caregiver for Nazar because his dad was gone on active duty during this time. It was quite taxing. It definitely it's been a journey. It was a little hard, and when we found home dialysis, as hard as it is, it's a lot more bearable to do than when we were in center.
Thank you. So as we move through this webinar today, I'll just go back and forth asking questions between the two of you. And also, I just want to thank you now for just being so open and just about sharing your personal stories with us today. So I'd like to ask both of you, what brings you here on this webinar to talk about home hemodialysis today?
Raising awareness, I feel, is very important. It's not something that I guess kidney patients and family are exposed to when something like this happens to a family member. So hearing that this is something that's feasible, we were all for it, and we are excited to spread the word that this is a possibility.
Thank you. So I'll start with you, Nazar. When you first started dialysis, you started at the in-center dialysis. So what was the in-center dialysis like for you?
Very crummy, in a sense, and very unpleasant. When you would go in, you would always hear coughing. You would always, most of the time, you'll hear crying, and sometimes there would be foul smells, and it's very, and it's cold. And all dialysis clinics are cold, but they don't really provide any blankets or anything, and yeah, it's very unpleasant.
And Nadia, so what was it like for you, the in-center dialysis as a parent?
As the parent, it was very difficult for me to, I guess, see my son in a situation like this. It's hard to, I guess, look at your child and see that they are, I guess, not well. I don't want to say suffering, but it's that they're, all the other teams are outside playing and my son is dialyzing. Everybody's going to the beach and he's, in the center having to dialyze. So as a parent, it's heartbreaking. And when we're in center, it's, they make it as comfortable as they could, but it wasn't enough. I wanted better for him. And that's why we were very excited to hear about home dialysis.
So how did the center dialysis, that schedule and everything else, affect your other child and, let's say, your family life?
Maya, my 8-year-old, she did very good I ended up having to talk to her teacher and asking how she was doing at school, because I'm like, I feel like she's being abandoned because I'm, so engrossed in Nazar's health and appointments and dialysis. And I'm like, I feel like I'm not being a very good mother to her. And it had its effect on her. She definitely, I guess she felt the, not, I guess, the attention she felt like she was lacking.
So at some point, you made the decision to switch to home hemodialysis. Can you tell us about how you found out about that as an option, and what made you make that change?
Well, we were fortunate enough to meet with a representative from the center we're currently at, and we got to talking, and he explained to us that this is an option, and if we were interested, he'd give us more information. And we were very excited to hear about it. Once he explained everything, we did everything that I guess to set up and prep. And once all that was said and done, yeah, the entire family, my husband was incredibly for it. My daughter was very happy that we weren't leaving, every other day for 4 or 5 hours a day, that I was at home with her. And yeah, it just made sense.
So how did you choose the home hemo dialysis as opposed to other options like nocturnal or the peritoneal dialysis?
Because Nazar is 15, having a hole in his body is something that I'm trying to, or he's trying to avoid, and I'm trying to do everything to help him avoid that. He wants to be able to be as normal of a teenager as possible, and if he was to dialyze, he's got that, he did a chest, or he's doing a chest pick, and then with a peritoneal, that's also, it's going to be an opening to his body, and that limits what he's able to do. And so we were trying to make a situation that's, it's bad as is, but we wanted to make it as great as possible.
Thank you for answering that. So, I'm wondering about, well, obviously there's a difference between, the in-center and home, and that you have to go through a training. So can each of you talk about what the whole process was like for you in terms of getting set up for the home hemodialysis and the training that you had to go through?
It's been very long. At first, it was fun in a way, but then I smiled the whole time, but inside I'm like, when is this over? And it's just, we came in every day. It's intensive training. Let's just say that.
And in what way was it intensive? What did you have to do?
Go in every day, set up, put bags on, set up everything every time it came.
And Nadia, what was it like for you, the training that you had to go through as a care partner?
Well, training in itself, it was intense, but it was feasible. They were very helpful, very knowledgeable. They explained the entire process, and at first it was a little overwhelming, but once you get your feet wet, it makes sense, and everything kind of falls into place. And Nazar did an amazing job. By the end of first week, beginning of second week, he was, I guess not on point, but he did really well as far as knowing what he's supposed to do and what needs to be done. And as a mom, I can, when he takes control over his life, when he's able to take control over his health, that for me, that's something that's worth going through. It made sense to do the training so he's able to have more control over his life.
So what about the cost? Is there a difference in cost in terms of going in-center for dialysis versus the home?
As far as cost, insurance for the most part covered everything. We got more, I guess we got billed a lot more from in-center dialysis versus home dialysis. And with home dialysis, I mean, aside from a few things, just for personal taste, we needed, or he needed, this or that. But it wasn't to where, it broke the bank at all. They provided everything that he needed, everything could possibly, need during dialysis, the medical equipment, the chair, everything that he would have to use in center. It literally just, it got, they took it and put it in his room. So, I mean, we didn't really, we didn't go through any financial difficulties as far as that's concerned.
So before you actually got started, what were your biggest reservations or concerns that you had about home hemo, and how did you overcome those?
My biggest fear was that nothing goes wrong. If there was an emergency, what do I do? And while we were in training, I voiced all of my concerns, all of my, what if this, and they were very good at explaining everything. And they taught Nazar, in case the power goes out, or in case, something happens, what do I do? And they went, until he knew what he was supposed to do, they went over and over and over with it. And as a mom, I'm just like, make sure you pay attention, make sure you're doing everything you're supposed to do, make sure everything's, you clean, yourself, and you sterilize everything. And he's been on point. So, that's kind of, I'm like, don't give yourself an infection by, not cleaning yourself well, or, clean your wound up. But yeah, no, he's been really good, and he's made my anxiety go way down, because he knows what he's doing.
That's good. That's good. So can you tell us about the process from your perspective of the home hemo? Like, what does the process entail? What are the preparations that you have to have? How long does it take? How often do you do it?
So he dialyzes 4 times a week. So he does Monday, Tuesday, Thursday, Friday. So the beginning of it, he preps his machine for, I guess it's like 20 minutes or whatever the prepping time is. And that's where he sets up the lines, and there's a pack that goes in there that he hooks up with all the tubing. And then it just kind of runs until it's ready to, or he's ready to hook himself up. And then in the meantime, he will set out, sometimes like his desk will look like a surgical table, because he's got all his supplies all lined up in a row, and all his alcohol swabs, the antibiotics, all the syringes he could possibly need, all the gauze he needs, the tape. And then he's really good about making sure everything's sterile, everything's kept sterile. He'll put on his mask, he put on his gloves. He's got a box of gloves right next to him, so you make sure that, once he touches anything, he takes them off and gets a pair of new ones. And so then he'll hook himself up, and then he'll start the machine, and it'll do its thing, and then he tapes the tubes to where they won't move, and then he's good to go.
So you had mentioned before you started, you did have some concerns, something would happen. So since you started, have any major issues come up with the home hemo? And if it did, how did you handle those?
The very first time, it was, he had run over one of the tubes with his chair, and the machine kept, putting out the code of there's an air bubble, and then, and stopping, because it'll stop as soon as there's anything wrong, it'll stop. And so, of course, my anxiety goes through the roof, like there's an air bubble, and it's going to go into his heart. And so when there's a phone number to call in case something like this happens, and they tell they let us know what the code means. Even though there's a booklet of what the codes are, it's kind of one of those, if you need something immediately, you call them, and they're like, well, this, and then it just ended up being that he just ran over the tubing and it stopped the airflow, and that's why the machine was doing what it was doing. So, yeah, and then one time our electricity had kicked off in the middle of dialyzing, and so that was like, oh my goodness, what am I going to do? But it was only for like 30 seconds, so we were okay.
So now I'd kind of like to shift the conversation and just have you all talk about how home hemo has positively affected both of your lives. And Nazar, I'll start with you. So going back to when you were doing the in-center, a lot of people feel really drained after and tired. Did you feel that way?
Yes, definitely. Very drowsy all the time, very worn down. I would have headaches. Yeah.
And how do you feel after you've done the home hemo? Is it the same or is it different?
It's very different. I would have a headache once a blue moon. That's when I don't eat. I feel more energetic after. In all, I feel very good.
That's good to hear. So, sounds like you have a positive attitude. How do you maintain a positive attitude while you're on dialysis?
Don't think about the negative, only think about the positive.
And so, when you're doing the home hemo, what do you normally do to pass time?
I would play computer games because I set up my machine where it's next to my computer, and so I would go on my computer, do some homework, or if I don't have any more homework to do, I would play some video games, or if I'm down off video games, I would just fiddle with something on my desk or YouTube.
And so, what has been the best thing for you about switching to home hemo?
Very flexible. I could dialyze whenever I want in the day or whenever I can. I can just control it without anybody telling me how to control it.
And so, what kind of activities can you do now that you couldn't do before? Can you give me some examples?
Go to the parks with my friends, because when I was in center, it would be on a time period where kids will be coming out of school, and I will be heading my way to in center. And by the time I would be done with in center, everybody would be sleeping. And so now I could either dialyze before everyone gets out, or dialyze after I play with my friends. And I can do camping. I can dialyze in camp.
Well, that's great. So tell me more about school. How is school different for you now?
I do in-home, not in-home. I do charter school. I have online work, and so it hasn't really changed. Kind of the same. Yeah, it's been the same.
What about maybe travel or maybe some other activities that you really enjoy doing now?
Travel has been easier without worrying about dialysis. I would dialyze before we leave, and once I done dialyzing, we would go somewhere for 2 days, and then we will come back and I'll dialyze again. It's been flexible.
So Nadia, I have a few questions for you. As a parent and caregiver, how has your life changed since Nazar started the home dialysis?
It's been day and night. It allows, the flexibility is amazing. When we were going in center, I had to make sure that either, someone was here watching the kids while I take him, or someone's able to pick him up from the house and take him, and then someone's able to pick him up and bring him home, or I'll have him wait there until I got off of work, or the last kid was picked up, and I'd go and I'd pick him up. And so if I didn't have a teacher here, or I didn't have anybody to pick him up, there'd be days where he would miss an appointment. And so that part was very hard, and very expensive, because it would be, I'd have to pay a teacher to be here for, 4, 5, 6 hours, 3 times a week, versus now if he has something planned during the day, he dialyzes earlier, or he does something during the morning and he dialyzes later in the afternoon. We worked, we're able, like you said, we went camping, and we had left on a Wednesday. He had dialyzed, we left. And so he, we took all the supplies that he needed with us. Was able to dialyze there. And it was like he was sitting in his chair looking over this ocean with the sunset as he's dialyzing. And I'm like, how many patients can say they were able to do this? And so home dialysis allowed us him to have that kind of an experience.
That's great. So what changes have you noticed in Nazar since he switched to home hemo? Maybe his activities, or his mood, or anything else that maybe you've noticed since the change?
He's become a lot more happier. He got a little blue there for a while when he was doing in-center dialysis, and I was doing my best to try to involve him in, youth from church or activities that they would have, but it just made it difficult because they do something while he was supposed to, be at an appointment, and he wasn't able to attend. With home dialysis, he's able to, he's able to go to, whatever activities that, his friends or the church has planned, and he just works dialyzing around that. And so it really changed him a lot. He's a lot more happier. He's a lot more cheery, a lot more positive. So yeah, I'm very happy for the change.
That's great to hear. So you had mentioned, camping and being able to watch the sunset. Are there activities that you can now do since you've changed together, outside of the camping and some other things?
We're able to go on trips. The hard part was on Fridays, because his appointment would be like midday, and so by the time he was done, it was later in the evening. Now it would be to where he'll dialyze early on Friday, and we're able to leave, it's still morning time, we're able to leave. We can do trips as a family, because we live in Elk Grove, which is a little south of Sacramento, and we can go up to Tahoe for the weekend, which before it wasn't an option because we can't leave, early enough to be able to make it up there, to have dinner with the family or whatnot. So that we noticed a big difference with that.
And so what has this change to home hemo meant for you personally? It's been great for Nazar to have more flexibility in schedule, and you said that he's been happier and being able to do new activities. But what about you personally? What's the change meant for you?
For me, it lessened my workload, if that makes any sense. I'm able to I'm able to do what I need to do as a mom, as a, a childcare provider. I can do what, I'm supposed to do, and he will be upstairs dialyzing. If he needs me, he'll call me down, but it freed up my time, and I'm, able to do other tasks around the house, or, with my daughter, or what needs to be done. So it definitely freed me up a lot, I guess.
So as a parent, we put the needs of our families first, but as a caregiver, it's important to take care of yourself. So what do you do to make sure that you do dedicate some time to care for yourself?
I had made it a point to do things that were just me. I wouldn't take the kids. I'd go to the gym, but I won't take my kids. I'll go to paint nights, and sometimes if there were days that I didn't want to take anybody with me, I just wanted, me time and just, around people, but I'm by myself and I'm relaxing, and, I don't have anybody to answer to. Nobody calls me, and, no mommy. So I made it a point to do things that were, I guess, purely for selfish reasons, but it helped, helped me keep my identity, if that makes any sense, and just, spend time just for myself, so that way I can, keep my sanity.
Well, thanks for sharing that. So, Nazar, I have a question for you now. As a young dialysis patient, what advice do you have for other young or new young dialysis patients just starting out? What would you tell them?
Stay on track. Don't procrastinate. Get it done. You can do it type of mood, and organize everything to the point that you know everything. Just lay out your things out on a flat surface, or somewhere you put your supplies on. Organize, order everything, and you're good to go. Be on point.
And how would you tell a young person, teenager, what would you tell them to do to just keep a positive attitude?
Don't think about the negatives, or don't think about the negatives at all. Just keep thinking about the positives, and you will get through. It's only temporary, and it's never permanent.
Well, thank you. So Nadia, as a parent, what advice do you have for other parents or caregivers whose child is starting dialysis?
As a parent, I feel when a child has, I guess, that much control over his life, it lets him have, I guess, their sense of self back. They're able to, they're responsible for, their life. And so I feel like when Nazar was able to dialyze at home, he got his sense of identity back. And so that's why a lot of the, training and everything, I had him, he was the one that was in charge of his, his life, and I let him have that kind of, power, because it would empower him versus, being the hovering parent and taking over everything and doing everything for him. I feel that when he does it on his own, then he has that sense of, hey, I'm a badass. I'm doing this. How many teens can say that they dialyze at home? It's dealing with blood, and it's dealing with, preventing infection, and he's able to do that. And I feel that kind of gives them a sense of just, he's doing an amazing job. And so I feel that it's good. It's good for his psyche. It's good for his just how he feels about himself. And I feel that that's what turned, it's not easy to go through what he's going through, but he is doing an amazing job, and it's showing.
So I'll ask both of you this question. I'll start with you, Nazar. So what are maybe the top 1 to 3 things that you would like to share with others about home hemo that you think they should know?
It is 100% better than in clinic, at least for me. And it's very, very easy once you get a hang of it. It's hard at first, but once you start moving, it gets easier and easier. Sure, you'll get hiccups in the road, but they go away fast. And it's safer and more comfortable.
Thank you. And Nadia, if you could share 1 to 3 things about home hemo that you think others should know about it, what would those be?
I would like them to know that it's feasible to do it. It might feel a little, at least for me, was a little daunting in the beginning, but once we went through the steps, once we got trained, once we started, they held our hand. They held our hand the entire time. Any questions that we had, they answered. Anything that any issues that came up, they took care of. And so it was at least for us, it was a smooth transition from getting trained in center and then doing it at home. But yeah, it's possible to do it.
And so the final question here, before we get to some of our audience questions, Nazar, what does the future hold for you? You're 15, so what's your future like?
Yeah, we're waiting for the bionic kidney. That's my biggest goal, is for the bionic kidney. That's all I wish for.
And Nadia, what does the future hold for you?
Well, like Nazar said, we're waiting for the artificial kidney to become available. And in the meantime, we'll just make do, and we'll just, take it day by day. And, hopefully it becomes available sooner than later.
Okay, so during the course of our discussion, we had some questions that we have from our audience, and I'd like to go ahead and ask you some of those. Okay. So I think I can kind of tell which one's directed at one of you or both of you. So this one's kind of for both of you. You each mentioned, in the beginning it was doing the home hemo. It was kind of awkward, I guess. And you both mentioned, it was fine once you got the hang of it. So how long for each of you was it before you got the hang of it? Nazar?
Mine was about 2 weeks. 2 weeks. And once those 2 weeks passed, I knew most of it, of what I was supposed to do. Sure, I would miss some stuff, but 2 weeks.
Mm-hmm. And what about for you, Nadia, as the support person for the home hemo? How long did it take you to get the hang of it and feel confident?
I think it took me maybe a good 2 months to stop worrying as much, I guess. Yeah, about 2 months where I got comfortable to where I was confident enough to where I wasn't worried that something could go wrong, or he didn't know what he was supposed to do.
Okay, so here's a question. So do you have an emergency preparedness plan for things like a natural disaster, kind of like the hurricanes that we've experienced recently, or anything else? So what plan do you have, I guess, in place for an emergency? Probably for you, Nadia.
Yeah, okay. In case of an emergency, we are, well, I guess he's got enough supplies to last him, a certain amount of dialysis sessions. And so if we were told to evacuate, our plan would be to, pack all his supplies into the trailer, everything that he could possibly need. He's got one of those big toolbox rolling things that all his supplies is laid out in there, and so it's for the most part very organized as far as knowing what he needs. So we'll literally pack it up, put it in the trailer, and that would and be able to evacuate if it was ever the case.
Okay, thank you. So another question, would you say it's harder to get in-center and home hemodialysis as a pediatric patient?
As a pediatric patient, yes. Unfortunately, not a lot of dialysis centers want to deal with pediatric patients. And so it's, I guess that it's because due to training, they need special training and whatnot. And so they just choose not to. But once I'm hoping once, home hemodialysis, especially, the fact that Nazar is a pediatric patient and he is doing it, that is a possibility. I really hope that it opens the door to a lot, for people to know that this is a possibility.
Okay, thank you. So I guess this could be for both of you. One question here is, home hemo sounds great. Are there any downsides to it at all? Nazar, what about you? Do you see any downsides to the home hemo?
That I have to do it.
Okay. And Nadia? Oh, I'm sorry. Go ahead, Nazar.
No, I'm done.
I guess the only downside is it is, his room is a little crowded. I wish he had a bigger room. We had talked about possibly, adding on to make his room bigger so the supplies can be, put away where they're out of sight. So, if he's not dialyzing, he puts his machine away, he puts the supplies away, and it becomes just a normal teenager room. So that's kind of a work in progress, but it'll take a little bit of time and money if that's something that we end up doing, to do. But I feel that would be that'd be great if we were able to do that.
So that kind of goes to another question that we have about the machine. How big is the dialysis machine? Does it easily fit into a car?
Yes, it would fit into a car. It's a two-piece, I guess, two-piece. You put them together. It is, let me see. If you were to put, oh goodness, oh gosh, I'm trying to figure out something.
A big suitcase.
Like a suitcase, like a big suitcase.
With a small box on top.
With a box on top. It's I guess the bottom piece It's about maybe 2 feet by 2 feet by 2 feet box, and the top one is like maybe a foot wide and a foot and a half long. So it would be able to fit into a car.
And what about the plane? Can the home hemo machine be taken on the plane, and are you allowed to dialyze while on the plane?
I think we had asked if we were ever to go to Hawaii for a week, if we were able to take our supplies, and they have a program or something there that you'd call in and be like, hey, I need to take my medical supplies with me, and they would work with you to dialyze on a plane. I think you'd have to talk, with the crew and see if that's something they're able to set up. But I feel like if it's, if it's like a 24-hour flight or, a very long flight, they would be able to accommodate. Or you would be able to set up and do it if that was something that needed to be done.
Okay, and there's a question about diet. Is there a difference in the diet when you are doing home hemodialysis as opposed to in-center?
Yes, there's a big difference. In-center, it's more strict because you're doing in a specific time, a specific day. But in home, if you eat something bad and high potassium or high phosphorus, you can go out of your way and do dialysis now or after you eat trash stuff. You have an option of dialyzing when it as soon as or you dialyze as you eat garbage.
So cheating on your meal.
Yes.
Oh, Nazar, I think you just told on yourself there. So Nadia, what about you? And you're the caregiver, and obviously, you are securing the food and, maybe preparing meals and things of that nature. For Nazar, how do you prepare differently in terms of the diet? Or how should Nazar be?
Yes. It's a little bit more flexible because he's able to dialyze 4 times a week. And then, if he ever needed to dialyze 5 times a week, he's able to do that. And like he said, if he cheats on his meal or he does something that I'm like, well, you need to go dialyze now because I don't want this, your kidneys are going to have a hard time processing this. He's able to do that. So it definitely gives us a lot more flexibility. And then it's, I don't have to, hound him to make sure he's eating correctly, and then, make sure that he doesn't have access to anything he's not supposed to eat, because that does become daunting for the rest of the family. But with home dialysis, if he does something he's not supposed to, I'll just turn on and be like, okay, well, go dialyze because he can use some help.
You mentioned, the other family members. So there's a question: how do you explain kidney disease and dialysis to your daughter? She's a small child, or maybe also other family members who may not live in the home all the time. How do you explain that to them? Nazar, you can answer first, and then Nadia, maybe your perspective too.
I explain how it works, what it does, and what it takes to do it. I explain it.
Okay. What about you, Nadia? You have a daughter who's 8. How do you explain that to her?
I told her that I explained what kidneys, the function of kidneys and what they do in the body, and I told her that with Nazar, that his kidneys weren't doing their job, and with the machine, what it helps is to clean his blood from the stuff that his kidneys aren't able to clean. And she had, I mean, it wasn't, at first she was a little, confused as to, and, there's blood coming out of her brother. So she was like, what is going on? But once she figured out that this is helping him and making him better, then she did really well with that.
So another question is about the machine. How does it run? Is it on electricity? How does it kind of work?
Yes, it is plugged into the wall. We were thinking of getting it's like an electricity battery where the battery would plug into the wall and the machine would plug into the battery. We're still working out to see, if that takes out any of the strengths of electricity. But, in case the power was to go out, we were thinking about getting him a backup battery just in case. But yeah, you just stick it into the wall and it just does it. And then there's tubes that go from the bottom portion, the stack portion. There's a tube, a black line that will go into, like for him, it goes into his bathtub for when he's dialyzing, or if he needs to empty the sack, it'll go into his backpack. And then there's a tube that goes into where the faucet is, like it's an attachment for when he's filling up the sack. So he's got a couple of tubes running out of his room.
So I think we have time for two more of our audience questions. One is about infection. What precautions do you take to reduce the risk of infection while dialyzing at home?
I don't let anyone in my room when I hook up. I would kick everyone and anything out. It'll be empty in my room. No one's in it. I would always wear gloves, always wear a mask. Every time I would hook up or take off, change gloves, wash hands, use hand sanitizer, clean with alcohol swabs. So all the precautions.
And Nadia, for you, what precautions do you take in the home to reduce the risk of infection while Nazar is dialyzing at home?
Well, like he said, he allows minimum traffic into his room. I don't allow pets into the house anymore on the off chance that, a cat would run into his room while he's dialyzing. And that keeps his room, as clean as a 15-year-old could possibly keep it. And just make sure he, just disinfects everything before he sets up and clears wipes off the counters if he was going to use, whatever to put his tools on or his supplies on. But it's not overwhelming. It's, I don't have to make sure everything's white gloved, clean. But yeah, he actually has done really well, and he, thank God he has no infections, and we've been doing good.
Okay, I think quickly we can get this one in. Do you have to take any specific medications with home hemo?
Calcitrol, and that's it.
Actually, he's on less medications now than he was when he was in center. If he needs, if they check his calcium's a little low, then he'll, we'll have him go on calcium. And he's got a Renagel, which is a phosphorus binder, a phosphorus binder if he was going to eat something with high phosphorus. But I feel it's less. He's not injecting any medication into his lines. And when he was in center, that would be something that he'd have done more often than not. But I feel he's getting less substance into his body now than before.
And very quickly, what's the total time in a week you spend on dialysis now?
In a week?
4 hours a day.
Mm-hmm.
Yeah, about 4 hours a day, and that's 4 days a week.
16 hours.
Yeah, that's 16 hours.
Okay. I think that's the last question that we can have for today, but I really want to thank you, Nadia and Nazar, for just being so open about your experience and sharing your story. And I think that's always very encouraging when people who are going through it can share the story and inform others. So we really appreciate you, doing this. So thank you so much. Okay, so just an announcement. Next month we have 2 webinars. Phosphorus in the kidney disease diet, our holiday edition, will be held Friday, November 9th, and hosted by registered dietitian Carolyn Fiebig, and managing diabetes and kidney disease will be held on November 28th and hosted by registered dietitian Lori Martinez-Hassett. Registration is now open for the phosphorus and kidney disease diet, the holiday edition, so please visit kidneyfund.org/webinars for more information and to register. When the webinar closes, please do not close your browser window. You may see a pop-up saying the webinar has ended. Close that pop-up and proceed to the webinar evaluation survey. Your honest feedback will help us make our webinar program the best it can be. Thank you for joining us, and we hope you join us again.